question. What is the difference between a psychologist and a psychiatrist? What about a psychotherapist and a counselor? If you're not entirely sure, you're definitely not alone. And in fact, these are some of the most commonly confused professions in healthcare. And today, we're going to clear things up once and for all. Welcome to the podcast, Psychology Reconsidered. My name is Rihanna, and I'm the host of this podcast. In today's episode, we're going to be talking about the main differences between psychologists and psychiatrists, as well as all the other related professions in the mental health field. So if this is a question that you've been wondering about, confusing, perhaps hoping for a little bit of clarity, this is the right place for you. So we're going to talk about some of the main distinctions, namely understanding the different training and credential required, practice, focus, as well as the setting that usually these professions are found in, as well as a little bit of the cans and can'ts of each profession as well. So let's start with my very favorite, the psychologist profession. To become a psychologist, one has to go through graduate level training to obtain their PhD, and in some cases, master's degrees are sufficient, and we'll talk a little bit about that in just a bit. So when I say PhD, what I mean by this is it's a doctor of philosophy. So you go to graduate school, you pursue your doctor of philosophy, and the training for psychologists is often called a scientist practitioner model, which essentially means that there's this combination of research focus as well as clinical placements and clinical hours. So that term implies that you are not only being trained as a clinician or as a practitioner, but a large focus of the training is actually centered around research. So that's where you do your PhD dissertation, in addition to all the courses that you're completing to get that breadth of knowledge in different fields of psychology and related domains as well. So you end up with a doctor title, and sometimes people confuse this with other types of PhD programs where you're also getting that doctor of philosophy. However, there's a distinction between pursuing your PhD in clinical psychology versus your PhD in experimental psychology. So these are two completely different streams, which both heavily focus on research, of course. However, the experimental psychology stream does not get accredited by a college, and it does not enable you to license as a clinician, in contrast to a PhD in clinical psychology, where you can both practice as a clinician as well as continue to pursue research as well. Now, in terms of the duration for training for psychologists, the PhD is typically anywhere between 4 to 6 years, and the clinical hours accrued greatly varies depending on which program you are training in, depending on the province, depending on the site, but it's usually anywhere between 1,000 to 2,000 hours, and it really varies and ranges depending on the program. Now, after this PhD training, you have to do something called a full-time 1-year residency program, or another way to put it is a pre-doctoral internship. So essentially what this means is after you've completed your research, coursework, those sorts of things, you are required to also further continue and accrue more clinical hours through this pre-doctoral internship. Once again, depending on the internship site, the hours can vary as well, depending on the state that you're in, the province that you're in. But essentially, it's a 1-year full-time placement where you're accruing more clinical hours. After this, there is yet more training, and individuals complete a 1-year supervised practice, or commonly referred to as postdoctoral supervised practice or training or fellowship. Now, after this supervised practice, you are required to complete a few other exams in order to get licensed to practice in a given state or in a given province. And those, once again, vary depending on the jurisdiction. But overall, there's usually a combination of written exams as well as sometimes oral exams are expected in order to become licensed, fully licensed with a given jurisdiction. So the exams usually include something called the EPPP, or the Examination for Professional Practice in Psychology, which essentially tests your general knowledge of psychology. And then the second one is the jurisprudence exam, or also known as an ethics exam. So this is where you are tested on how to practice psychology legally and ethically in the given jurisdiction that you plan to license in. Once all of that is done, by then you are licensed to practice in a given state or in a given province, and you have that binding between the American Psychological Association or the Canadian Psychological Association. Now, there are some instances where one is permitted to practice with a master's level licensure. So there are small few provinces as well as US states that permit this. However, oftentimes this usually requires additional supervision or supervised hours to become licensed, or sometimes there are different professional titles that are given to individuals that don't hold a PhD. Now, to confuse things a little bit further, there is actually yet another pathway that you can become a psychologist in Canada and in the States. So we've been talking primarily about a doctor of philosophy or a PhD to become a clinical psychologist. However, there's another stream that is actually not that common in Canada. It's a little bit more common in the United States. It's called a PsyD. And a PsyD is basically a doctor of psychology rather than a doctor of philosophy. Now, there are very important distinctions between a PhD versus a PsyD, in that a PsyD primarily focuses on clinical work and is very limited in research. So a whole chunk of the program and the training is very focused solely on clinical work. So they don't adapt that scientist practitioner model. Rather, it's more focused on a practitioner model. And so they have all the coursework as well as all the intense clinical hours and supervision as part of their training. But research is often not the main focus like it is in PhD programs for clinical psychology. Another key distinction is that PsyD programs have little to no funding, whereas PhD programs are usually funded, meaning that there is some sort of stipend that the graduate programs provide you with to help you complete your PhD. And PsyD programs usually require you to pay the programs, and in some instances, there may be opportunities for grants and scholarships for students to also get for further assistance. So that is a little bit about what is required for training to become a clinical psychologist in North America. Now, you might also be wondering, well, where are these psychologists usually found? What is kind of the nature of their practice? What settings are they usually found in? As well as what do they typically do? So a clinical psychologist can nearly be found anywhere and everywhere. They can be mental health professionals in inpatient and outpatient hospital settings, universities, community clinics, schools, prisons. It's a very broad profession that can be found anywhere. And in terms of what they're able to do, one of the biggest things is providing psychological assessment and diagnosis, which very few professionals are able to do legally. So here they are able to legally assess and diagnose individuals with mental health concerns. Another big piece is providing treatment or therapy. So that could be individual therapy, that can be group therapy, that can be couples therapy. And of course, a big component of their work is centered around research. So running studies, contributing to papers, knowledge translation, and those sorts of things. Now, one thing to consider is that there are limits as to what psychologists can do, the types of individuals and populations that psychologists can work with, and this is all dependent based on their acquired training and supervision. So just to give a simple example, individuals that have trained to be adult psychologists, they can't necessarily work with children per se. That requires a whole different type of training and a whole different type of competency that needs to be acquired in order for you to be able to see children. Likewise, the types of treatment approaches that psychologists deliver is also limited in terms of what training and what competencies they've required from the past in the form of supervised clinical hours. Now, that doesn't mean that if you've got most of your training working with adults, you can't work with children. It would just require you to attain your competency in that area through taking additional courses, pursuing further supervised practice hours, and those sorts of things. In terms of prescribing medication, generally, psychologists are not allowed to do that. In Canada, that is never possible. However, in the US, there are a handful of states that allow prescription of psychotropic medication so long as the clinical psychologist attains additional training. And then they become prescribing psychologists. And so that additional training will look like attaining a postdoctoral master's in clinical psychopharmacology or some equivalent prescribing certification. And this is typically an additional 2 to 3 years and education and supervision to be able to have that right. Once again, within the 5 to 6 states that allow this. Now, another point to keep in mind here is that the types of medications that these psychologists can prescribe is also limited. So they are not like psychiatrists that have that broader scope of prescribing, or family doctors. They are limited in the types of medications that they can often prescribe. Now, this is a great segue into talking a little bit about psychiatrists. A lot of people often confuse the two professions, and they are in fact quite different, not only in the training required, but also in the types of work that they do, what they're allowed to do, what they can't do, and those sorts of things. So when we talk about psychiatrists, after completing undergraduate training, psychiatrists go down the medical school route instead of the graduate school route. So once again, they do the courses, the clinical rotations, and those sorts of things. And at the end, they end up obtaining a medical degree, an MD degree. So you become a medical doctor rather than a doctor of philosophy like clinical psychologists become. Their training is also largely focused on the biomedical side of things, not so much on the psychological aspect and the behavioral aspect like clinical psychologists. And after completing the 4 years of medical school, individuals go on to complete a 4-year residency in general psychiatry. And if you further want to specialize in a different type of subspecialty of psychiatry, that'll be another additional 1 to 2 years of something called a fellowship to attain that specialized training. And of course, after that, there are some licensures and certifications that individuals need to complete in order to be legally allowed to practice. So medical licensing exams and board certification exams, as well as any other specialty certificates that individuals may want to pursue as well. A key thing to note here is that in the United States, there are actually 2 branches of programs that individuals can pursue in order to become physicians or psychiatrists in this case. So this is the MD route that I just mentioned. So it's a medical doctor. And then there's actually another type of stream that less individuals know about, and it's called the DO route. So this is Doctor of Osteopathic Medicine. And once again, this is only possible in the United States. Canada does not have this. And so the main distinction here between MD and DO is that DOs have this additional training in a more holistic approach to medicine. But importantly here is that MDs and DOs complete the same type of residency training and have the same ability to diagnose, treat, prescribe medications, including in the field of psychiatry. So what exactly do psychiatrists do, and how is it different from clinical psychologists or psychologists? So again, they're also able to diagnose psychiatric disorders. They are legally allowed to prescribe medication and manage that medication, which, unlike clinical psychologists, usually they are not allowed to do that. Some psychiatrists will actually also provide therapy, though this is not as common and it's often not their main focus of practice. In terms of settings, like psychologists, they can be found in hospitals, in private practices, in the emergency department, in academic medical centers, and forensic settings as well. So again, a really, really broad level. And you can almost view this as wherever psychologists can be, that's where psychiatrists can also be found. They are often actually working together in interdisciplinary teams, in fact. So hopefully that clears up the main distinction between psychologists and psychiatrists. And there are a few other professions that people very commonly confuse with psychologists, and that is a psychotherapist. So once again, there is a large difference here between psychologists and psychotherapists, not only in the training, but also in the types of patients or clients that they often see and in the settings that they are often found in. So just a little side note, unlike psychologists and psychiatrists, psychotherapists are not a single standardized profession. Instead, it refers to regulated or trained professionals who provide talk therapy. So it's a little bit less rigid in terms of how it's defined across different states and different provinces. For instance, in the United States, psychotherapist is almost like an umbrella term for anyone that is providing talk therapy with appropriate licensure. Now, looking at Canada more specifically, in most provinces, in order to become a licensed psychotherapist, after completing your undergraduate training, you have to complete 2 years master's training in psychotherapy. And once again, there's coursework required here and clinical work. However, there is significantly less hours than psychologists needed in order to become licensed. And of course, there's no research as well. In terms of providing therapy, there are, once again, similarly to clinical psychologists, different modalities based on individuals' competency area. It's often focused on talk therapy, but there are a variety of other modalities that can be applied. And psychotherapists can, of course, see individual clients. They can do group settings and couple settings and those sorts of things. However, they are often seeing individuals with less severe presentations, though, of course, there is still quite a bit of complexity that can be found in the clients that they are seeing. The main distinction, in addition to the amount and type of training between psychotherapists and psychologists, is also in that psychotherapists cannot conduct psychological assessments or diagnose like clinical psychologists can. And then the main distinction between psychotherapists and psychiatrists is that psychotherapists also cannot prescribe medication like psychiatrists can. Now, another type of profession that often gets mixed up in all of this is counselors and social workers. So when we talk about counselors, there is also often times a master's level training that's required. So whether it's a master's of art or a master's of science in counseling or a related field, oftentimes counselors will provide talk therapy, and that is kind of their main focus. And they are usually seeing individuals with more mild to moderate health concerns. And similarly to psychotherapists, their training includes coursework, supervised practica, and those licensing exams that all professions have to do. Similarly to psychotherapists, counselors also cannot conduct psychological assessments or diagnose individuals or prescribe medication. In terms of social work, often a master's of social work is required, though there are individuals that sometimes begin with a bachelor's of social work and then progress to a master's, which is often more competitive, especially these days. And similarly to counselors, coursework, clinical hours, and licensing exams is the most common pathway. Now, the neat thing about social work is that their practice is often very broad, in that they can provide therapy, they can offer crisis intervention, case management, community outreach, family and system support, and those sorts of things. So social workers are quite literally anywhere and everywhere. They are very knowledgeable. They know how to get resources. They know how to connect their clients, and they are very vastly knowledgeable in so many different areas. Similarly to psychotherapists and counselors, social workers also cannot conduct psychological assessments or diagnose or prescribe like psychiatrists can. So just to provide a high-level overview of all the distinctions that we made today, when we think about psychologists, they are doctoral level clinicians with either a PhD or a PsyD trained in psychological assessment, diagnosis, psychotherapy. They work across hospitals, private practices, schools, and community settings, and generally, they cannot prescribe medication. However, there are some states that permit this. Their practice is often not just clinical in nature. They often have roles in research settings as well as consultation. Psychiatrists, on the other end, are medical doctors, typically MD or DO, who complete psychiatry residency training and specialize in the medical diagnosis and treatment of mental illnesses, including prescribing and managing psychiatric medication. Sometimes they may provide therapy, but that's often not where most of their chunk of time is devoted towards. In terms of psychotherapists, they are typically master's level trained clinicians and primarily trained in psychotherapy, individual, couples, families, and group therapy. Their regulations really vary by jurisdiction. However, they cannot diagnose or prescribe medication or conduct psychological assessments. When we look at counselors, they are also master's level clinicians focused on talk therapy and supporting individuals with common mental health concerns like life stressors and adjustment difficulties. These professionals also cannot diagnose or prescribe medication or conduct psychological assessments. When we look at social workers, they are typically master's level clinicians who combine psychotherapy with crisis intervention, advocacy, case management, and systems navigation, and they work across the healthcare, the education system, and community settings. They cannot prescribe medication or conduct psychological assessments or diagnose mental health conditions either. I hope today's episode helped clarify the differences between psychologists, psychiatrists, psychotherapists, counselors, and social workers. And while their training, roles, and scope of practice differ, each profession plays a unique and important role in supporting mental health and well-being. Ultimately, these professionals often work together, bringing complementary skills and expertise to help individuals receive the care that best meets their needs. I hope today's episode gave you something new to think about, a practical insight to take away with you, or perhaps a belief worth reconsidering. Until next time, stay curious, keep asking thoughtful questions, and don't be afraid to reconsider what you think you know.